You are watching the DOCtalk Show.
Good evening, our dear viewers. Welcome to the DOCtalk Show. This evening is a special edition which has been recorded at our facility here at Kawempe National Referral Hospital. My name is Dr. Lwasa Joel. I am an obstetrician and gynecologist at Kawempe National Referral Hospital. And together with me, I have my dear colleague.
Dear viewers, my name is Eevely Tushemereirwe. I'm a midwife working at Kawempe National Referral Hospital. You're most welcome.
Thank you, Eevely. We work in the family planning clinic of Kawempe National Referral Hospital together with other departments. Now, Kawempe National Referral Hospital is one of the national referral hospitals that offers maternal and newborn care services. Apart from maternal means that we take care of women before they become pregnant, we take care of women when they become pregnant, we take care of women during their birth process and even after. Now, a part of the child care services.
Yeah, we have pediatric services, we have adolescent services. When you are a mother, you come with a baby, you can have them at one point. They care for the mother and they care for your baby.
Yes, in pediatrics also do immunization for both young and the adolescents. You have heard of the HPV vaccine for cervical cancer, we also do it, but also offer sexual and reproductive health services outside pregnancy and childbirth. Now, today's show, we are going to have an interesting topic. It's about postpartum family planning. Postpartum family planning is that family planning that you use to prevent pregnancy within 1 year of having a baby. Now, we know that in 2022, about 2 million babies were born. And of those women who delivered close to 2 million babies, only 7% got family planning within the first 6 weeks. And this use can be as low as 4% in some countries, especially in northern Uganda. Can be higher than that in central Uganda, maybe reaching up to 15%. We know that up to 80% of women want to delay their next pregnancy for about 2 years. But in Uganda, we have an unmet need of up to 33%. So now, if you take an example of our facility, Kawempe National Referral Hospital, we deliver close to 25,000 babies every year. And in the last financial year, only 7% received postpartum family planning, meaning that 93% of the women did not go away with a long-term method. So, working with Maristops Uganda, Maristops has taken up initiatives to upscale the use of family planning methods in the immediate period of delivery. They used such similar interventions in Western Uganda and improved the uptake up to 21%. And in adolescents, they went as high as 31%. Now, we have interventions ongoing in Kawempe National Referral Hospital that are to help us upscale the use and offering of postpartum methods. Eevely, can you, if you talk about postpartum family planning, what do you want to tell our viewers?
Okay, for us to know that about family planning, we have immediate family planning. The methods that you can use within 48 hours after the baby has been delivered. We also have early, which goes from 48 hours up to 4 weeks, and we also have interval from 4 weeks and above up to 1 year. In these immediate or interval or the delayed one, we have different types of family planning or the methods.
Yes, so that means a woman who has a baby can have a method, a contraceptive method, as early as 10 minutes and as late as 48 hours when she's still in the hospital. But if she misses that, she can get it within 4 weeks. And if she misses that, she can get it after 4 weeks. Now, why do we want to emphasize this postpartum family planning? The reason is simple. If we know that over 80% of women want to delay their next pregnancy by at least 2 years, why do we have so many leaving the hospital without a method? We know that a good majority, a good number of those who want the method come back before 1 year when they are pregnant. And the reason is that they want to, many of them actually want to first see their period before they come back. Many of them want to take on breastfeeding as a method of family planning, and as time goes on, they end up actually pregnant without seeing their period. And many of them think that they cannot conceive early, so they can have, they delay, they have sexual intercourse earlier than what normally people do. So, and then we have those people who lose their babies, unfortunately. But that means that those people actually are fertile again sooner than their counterparts who are breastfeeding. We know that when we use postpartum family planning or family planning in general, a mother who has a baby has time to recover. For example, when you have a baby, you bleed and you lose blood. So your blood levels actually become low. When you lose blood, you need time to regain that blood before you have another baby. Now, people who conceive before they make 2 years, many of them have conceive again when they are anemic, when their blood levels are still low. And that means it will affect this pregnancy. Some of them end up having an early birth, they deliver before term. Some of them end up having a bleeding. They actually bleed more because they already have low levels. Some of them have miscarriages. Some of them even have stillborns. That means the baby dies before they are born. Or if they are born alive, some of them have low weight babies.
And to the babies, when the pregnancy, another pregnancy is delayed, these babies will have love. So we want us to use family planning because our babies will feel loved and they'll share the love between themselves and between their parents. There is good feeding. If they are few, let's say they are few, or you have planned for them, because we remember children by choice, not by chance. So they'll have good feeding because you'll have planned for them. They'll have good education because you'll have planned for them. Where will they go to school? And they'll have less violence in a home because everyone is happy. They want them to be there. For children, wrap it all with love. When you have love, they'll have everything.
Yeah, so when we talk about this family planning practice, we don't say that you don't have children. We are saying that you have children when you plan to have them, you space them, and you stop when you want. Not being taken by surprise. We know that majority of our pregnancies in Africa in low resource settings are actually unplanned. So we want to move from there. We want to move from there and have a better plan for our families. And generally, when families actually are planned, even the resources are enough for them. You know, If you have land, you can share the land equally with the 3 children or 5 children that you have. If you have a business, you can equally share, or significantly get a good portion for your families.
What are we saying? That, as Dr. Lwasa said, if you miss family planning immediately after birth, have it after the 48 hours up to 4 weeks. If you miss it there, come for the interval 1, 4 weeks, up to 1 year, for us to be well, to live happily in our families.
So, we now know that getting a method of family planning as early as delivery is a safe venture. And evidence has actually supported that these women have experienced fewer side effects, like we are going to show, we are going to discuss later on in the show. Meanwhile, we can have a commercial break and we shall be back soon.
This message is from the Ministry of Health with support from partners. You are watching the DOCtalk Show.
Yes, welcome back, our dear viewers. This is the DOCtalk Show. Before we went for the break, we were discussing the different methods. We actually said that using postpartum family planning immediately after delivery has been found to be safe, and the side effects are better tolerated. In this segment, we are actually going to look at the various methods that we can use during the immediate postpartum period. Now, we all know that some of these methods have been there with us for a long time, and those are the natural methods. Natural methods are those that actually where you don't use any other thing, and they are based on really timing. The commonest natural method after delivery, I think, is the breastfeeding. Women who are exclusively breastfeeding and have not have their period return and are within 6 months are safe to use that as a natural family planning method. Mind you, they are supposed to be exclusively breastfeeding, breastfeeding over 8 times and including on demand. 2, their period should not have returned, and 3, it should be within 6 months of delivery. It can be taken as a natural family planning method, and it is quite effective. The other natural family planning methods include fertility awareness, where a woman should know when her fertile days are. The fertile days are usually within the mid-cycle, and in this time, either they use another method, like a condom, or refrain from having intercourse. If a woman has periods that are not regular, sometimes misses, sometimes comes before the time she anticipates, then this method cannot be used reliably. Another common natural family planning method is the withdrawal method. I know it's a hard one, especially for men, but also for women. But some people have used it as a family planning method. Apart from those natural family planning methods, we have the permanent methods. These permanent methods are meant for people who have had their family size. If I want to have 5 children and I've had 5 children, I can choose to have a permanent method. That means my intention is not to have another child. For men, we have vasectomy. We cut and tie the tubes. This one can be done anytime, even when a woman is pregnant, but also when she has had a baby. So we encourage men to take part of the family planning venture and assist the ladies. If they want a permanent method, they can have their tubes tied. We know that the tubes do not affect the man's performance in bed, but tying the tubes stops movement of sperms from where they are stored to be produced into the woman's vagina during intercourse. So having this method is very important and key when used. So for women, if they choose to end their reproductive career, they have stopped having children, they can choose to have their tubes tied at delivery. For example, if a woman undergoes a cesarean section, she can have her tubes tied and cut at delivery. But also, if she has a vaginal birth, we have safe ways of tying and cutting the tubes for permanent contraception. And this should be done within 7 days of delivery. If a woman wants to have this permanent contraception and she's beyond 7 days, we advise that she delays this intervention up to when she makes 6 weeks and above, and we can safely offer the method.
Apart from natural methods and permanent, to have long-acting reversible contraceptive, where we have intrauterine devices and implants. We also have short-term contraceptive, where we have the pills, where you have to take a pill every day. We also have injections, and what is common is after every 3 months, you receive this injection to either delay the contraception or whatever interest that you have that made you to have family planning.
So when you use the the long term, the IUDs, they can be safely put after delivery. Yes, we can use the IUD when you have a normal birth. We can put the IUD immediately, or if you have a cesarean section, we can put the IUD immediately.
Sure.
Now, the advantage of using these methods as early as delivery, one of them is that you do not experience the side effects as much as you would when you put it when it is not after the delivery process. Now, some of the side effects that you can have when you use an IUD can have maybe an increase in the flow. You can have an increase in the vaginal flow, but some women can have an increase in cramping. Otherwise, they are quickly and easily reversible. As soon as you remove the IUD, the woman can get pregnant in the next cycle. As soon as you remove the implant, the woman can get pregnant in the next cycle. However, our friends who use the short term, maybe the injectable.
Our friends who use injectables, they also have the good things that it is going to delay the getting pregnant for our dear viewers, but it also has some side effects, and one of them can be weight gain. They can have menstrual disorders. You bleed the time that you're not expecting, or spots. You spot bleed, not the bleeding too much, but today you see blood, tomorrow you don't see it. So those are some of the side effects. And also the implants, like we said, they also have the side effects. One of them is also weight gain. They can also interfere in the bleeding cycle, the menstruation cycle. They have advantages and disadvantages. We can always come to Kawempe National Referral Hospital for more of the information. Before you have any method, we tell you about its advantages, its disadvantages, and it's your right to choose it when you have learned about it.
Yes, our clients all over, they like using the injectable. I think because it leaves no evidence, but also it is easy to administer. Unfortunately, sometimes it is not very easy to reverse the methods. This method, the injectable. Some women actually take up to 3 years before they can conceive again, despite the fact that they actually stopped using the injectable. In that regard, it is okay if a woman chooses to have an injectable, if she understands the side effects and the benefits, but it is also, we advise that if you are using it, if you may not exceed 2 years, you use it and don't go beyond 2 years. It will be very good and very safe if used in that regard. Now, the other pills that are taken daily, of course, they have the side effects, but also they are easy to miss. When you miss more than one pill, more than 2 pills, you can actually get pregnant, even when you continue using the pill. If you miss, you have to take more than, if you miss one, and you remember, you have to take the one for that day. So you take 2. So it is very, they are very effective, but also they need a lot of discipline. Let's go for a commercial break, and when we return, we shall talk more on this postpartum family planning.
This message is from the Ministry of Health with support from partners.
Tuliko ground, Plascon, paint and win. Yes, yeah, Plascon, paint and win. The ground, Chicho, buy paint worth 100K. Get a scratch card, SMS the code to 7197. Stand a chance to win instant airtime, 1 million shillings bully day there, or a share of a 3 million shillings jackpot each week. What do you want the brand new bodas, tuk-tuks, and so much more. Catch the paint and win action every Monday on Bukede One, NBS, and Sanyuka TV. Plascon, color your world.
You are watching the DOCtalk Show.
Yes, welcome back, our dear viewers, from the break. Now, before we went for the break, we were talking about the different methods available. I was reminded, actually, of the commonest methods that we use, we see our youth, and these are bought over the counter, and most times people don't come to the facilities. Commonly, many male condoms are used, and they are very useful in preventing unwanted pregnancies, and female condoms are also used. We know that in addition to contraception, these female condoms are very important in female condoms and male condoms are important in preventing sexually transmitted diseases like HIV, gonorrhea, and the like, chlamydia, etc. But we also know we have our emergency pill, also called morning after pill. Yes, this one should be taken within 72 hours of unprotected sex. And you have a thought or a fear that maybe you are probably in your unsafe days or your days near or close to ovulation. And when you take it, it should prevent you from, actually it works by delaying ovulation. I need to emphasize that family planning methods have been developed to prevent you from actually forming a baby. Their role is not to destroy a baby that has already been formed. So they work at different levels in our system, either the brain, the ovary, or locally in the uterus, or even in the reproductive organ, to prevent you from forming a baby. And by that, they are actually not for abortion.
Okay, now for all of us to know, what should we take in this? That there are very many different family planning methods, but what works for you might not work for a friend. Let us always come to the health workers. Let's come to Kawempe National Referral Hospital. Let's go to hospitals and inquire. They teach us, they counsel us about this family planning method, such that we take the best for each. And I should say that there is no anywhere we are testing blood to get the suitable family planning method. But there is a make will. When you come and we take the history, we look about other things that concern you, we can give you the best method according to how you are. What works for the other might not work for you. Let's come to the hospital and then we seek for counseling and the guidance about these family planning methods.
Yes, we know that majority of these family planning methods or contraceptive methods have side effects. But I want to assure you, our dear viewers, that all these side effects are manageable. All the side effects are manageable. I think the one that has maybe the, I even won't call it a side effect, because if someone has a permanent method, their goal is to actually stop to have children. And the role of the method is to actually be a permanent method. Now, I know some people actually end up changing their minds, or they get new partners, or God forbid something bad happens to the children they already have, then it becomes quite expensive and hard to either reverse the method or have a child in another way. You have the assisted reproductive technologies. Now that actually takes me to a point where we have different myths in our communities, where people have different informations. For example, there are some people who say that these family planning methods are the cause of fibroids. We know that being African, being black is one of the risk factors for fibroids. Not having children, or having a big gap, or even having a high BMI. But we actually also know that some of these family planning methods are actually protective against fibroids. For example, if you use the implant or the IUD that has a hormone, it actually helps you against the fibroids, but also if you have them, it actually works and relieves the symptoms like the heavy bleeding, the pain, or even the size of the fibroids. Cancer. There is no family planning method that has been associated with a gynecological cancer. In fact, most of our methods, especially the IUD, is protective against cancer of the cervix and cancer of the uterus and cancer of the ovary. The implant is protective against the cancer of the ovary and cancer of the tubes. Okay? The birth defects. The goal of the family planning method is actually to stop you from getting pregnant. Peradventure, if this method fails, there is no method that has been associated with getting or having a baby with birth defects. Some people say that infertility follows using a family planning method. Whereas some methods, like we have discussed earlier, the injectable, sometimes may be hard to reverse and takes you a number of years before you can be able to get pregnant. Generally, these family planning methods are not responsible for women failing to conceive. We know that the commonest cause of difficulty to conceive is tubal disease. Women can get sexually transmitted infections that affect their tubes and then end up the tubes getting blocked. But it's not a family planning method. And we know that some methods actually help in preventing sexually transmitted infections, like condoms. We know implants are helpful in that regard. We know that the hormonal IUD is also helpful in that regard.
The other myth that we have, or that we've encountered with women when we are counseling them, loss of libido for both men and women that when I use family planning method, I don't have the urge to have sex. We also have people talk about infections. Now, infections, they usually associate it with the IUD or the intrauterine device. That's why we said that when you want to have these family planning methods, there are a number of things that we also do before we have them. If you already have infections, we are not going to give you the IUD because we are going to tell you about them, that when you have it and when you have the infection and you get it, it is going to accelerate to other, to the area where they have put the IUD, and the infections will become maybe worse. The other myth that we have is the movement of method from the method moving from the point of insertion to other parts of the body. For example, they have always said that IUD moved from the uterus to the heart. That's not true. Let's take it, our dear viewers, that when we come and get the counseling, we shall get the best information. And maybe this takes us also to the barriers why other our friends are not taking up the family planning method, like culture, the religion. We are saying from the beginning that they are safe and they are not, how can I say, in religion, they are not against God. So let's take them up and we have our babies by chance, by choice, not by chance.
So yes, we know that by culture, people have been always encouraged to have many children. And that was years long ago, where you could have 10 children and only 5 survive. But now we know that with interventions, with care, care for the mother, care for the baby, and increased income, we have a high survival rate for babies, for women, and for adults at that. So that cultural thing about have many children should actually be a change of perspective. But also, we know that if we know that these methods, some of these methods that are available options for women who have just had babies, why aren't we using them? I think one of the things is that health workers, even the patients themselves, don't have this information. Some health workers actually want to encourage women to first use breastfeeding. But some of these women actually conceive within the first 3 months. Because when your period returns, before 6 months end, it means you can actually get conceived. And we know that actually this has happened. Yes, we also know that we don't have enough support, especially from our partners. Men always think that this family planning issue is a woman's issue. But I really want to say today that family planning is a family planning. A man and a woman, or the individual or couple, they sit together and agree when to have children, how many to have, and when to stop. So I want to encourage men. I'm going to encourage men when they come back for the commercial break. Thank you.
This message is from the Ministry of Health with support from partners.
Uganda will host the African Union Extraordinary Summit of Heads of State and Government from the 9th to the 11th January 2025 at the Munyonyo Commonwealth Resort and Convention Center. The summit will consider and adopt the new Comprehensive Africa Agriculture Development Program, CADIP framework, and sign the Kampala Declaration to run for the next 10 years. The CADIP Kampala 2025 Summit will unite over 2,000 delegates, including government leaders, private sector and stakeholders, under the theme, Building Resilient Agri-Food Systems in Africa.
You are watching the DOCtalk Show.
Welcome back, our dear viewers. This is the DOCtalk Show. Before we went for the break, I was calling on 2 men to actually get involved with their partners to actually meet this family planning issue and handle it together. We know that men have fewer options. They have the condoms, the withdrawal, and also the vasectomy, cutting the tubes. But if they came with their wives to facilities for preconception care, if they came for antenatal, if they came for delivery services, postnatal services, immunization, they will get information, they will get counseling, they will help their partners actually to make a decision on which method will suit them as a couple best. We know that men who support their women in making this decision, the couple ends up using the method for longer. In fact, they tolerate the side effects better. But when they never took part in that decision, they actually will have a barrier to use. In fact, some women change their mind after making a decision on using a method. They change their mind because their partner said otherwise. But if they had gotten information, it would be an easy decision for them to make.
Okay, thank you, Doctor. Actually, also one of the barriers to family planning take-up is lack of awareness. People do not know where to get this information. But we do all these services here at Kawempe National Referral Hospital, right away from preconception. If you want to conceive, or if you have conceived and it is as early as the day you have known that you have missed your menses, please come. We have information for you, preconception, antenatal. We want to encourage us, our dear viewers, that family planning, contraception, contraceptives begin right away from antenatal. When you are relaxed, you are carrying your baby, but that is the best time for you to know how many you shall have and for how long you shall take. So we don't want to make decisions when you're in pain and we assume that it is the pain that has contributed you to having that family planning method. So during antenatal, we have information for you. We have good counseling for you. During labor, we recite back what we agreed on in antenatal. And after delivery, we have our method. Like we have said, we have immediate postpartum family planning method. So when you have known it in antenatal, you'll have it welcomed after delivery. We also have these services after delivery, that is in postnatal. Like we said, even after postnatal, we have the interval one. You have gone home and you have reviewed your plan. So you come back at the interval level and we still offer you these services. And I want also to say that they are free of charge. We don't charge any of these services at Kawempe National Referral Hospital.
Yes, these services are available and free of charge, like my colleague has said, but they are also available all the time. Being day, be it night, be it weekend and weekday, our very capable staff are always available to offer these methods to mothers who actually want and make a decision and also are eligible to getting the methods. Now, you would ask yourself that why are we talking about this immediate postpartum family planning? First of all, we thought that it was unsafe, but now we know better that it is safe. Secondly, it saves you time that you move. If you come and deliver and you receive your method of your choice, it saves you time that you would use for other things. If you don't get the method and you get it later, you have to come back, visit the facility, go into the queue, be assessed and receive the method, which is okay. But if you save that time for other things, I think it's very important for you and your family and your general well-being as well. Thirdly, because some of the side effects when you start using the family planning method occur in the first 3 to 6 months, we know that also during the first 3 to 6 months of having childbirth, your body is changing back to the pre-pregnancy state. It means that the side effects that you would have experienced are masked there, and you actually don't recognize them as side effects. And by the time you resume your sexual intercourse, you are good to go. Now that we know that these services are available, we know that we have skilled personnel. What can we do actually to make sure that these services reach to our dear viewers? We have set up trainings in, for example, in Kawempe, but also in the Kampala metropolitan area. Facilities in Kampala metropolitan area have been, most of the health workers have been trained to make sure that they can safely offer these services. Now, what we are looking for are the users. Are the users available? Yes. Are the users ready to get on the methods? That is another thing to actually assess. But when we offer this information, when we offer this kind of care during antenatal, like Eevely has discussed with us, offer the information during antenatal, offer the information during admission for delivery, even after delivery. And also, we have had partners that have helped us make sure that we always have these methods available. Sometimes people want, for example, a mother can be wanting the implant, but it's not available. So she will not get the method because a method of her choice is not available. Or she wants the IUD, and the person available cannot safely offer the method. So she will not go with the method. Now we have made sure that the methods are there, the skilled personnel are there, and the hospitals and facilities are open for most of the time. Kawempe, for example, is open for 24 hours, 7 days a week. And these methods are available 24 hours, 7 days a week.
In a nutshell, we are saying that Kawempe National Referral Hospital, we have family planning methods, like right away we said, immediate ones, the early methods, and also the interval. So if you don't get it immediately after delivery, you can come at any time and we shall have it. Don't ask a friend in case you get any of the side effects. Please come to us, health workers, come to Kawempe National Referral Hospital, come to trained health workers and get the right information.
So all in all, we would like to send our sincere appreciation to the government of Uganda and the Ministry of Health at that for making these services available and accessible and free of charge, together working with other partners, free of charge in Kawempe National Referral Hospital. We would like to thank you, our dear viewers, and also wish you a Merry, Merry Christmas and a Happy New Year. Enjoy safely and enjoy responsibly. As we enjoy, Kawempe National Referral Hospital shall be open throughout the festive season. But also, those who enjoy, we shall be waiting for you next year in the antenatal clinic and for delivery services. Thank you so much. God bless you.
As we go to the festive season, like he said, let's remember that when we are enjoying, we are also protecting ourselves against any other diseases apart from the pregnancy. And let's have the children when we want them, not to have them by chance. We love you and we wait for you any other time. When we come, you are most welcome to ask us. We are there at your service. Bye.
This message is from the Ministry of Health with support from partners.
UBC, inspiring Uganda. This week on UBC.
I'm Captain Patrick Asimwe, the Assistant Project Engineer for the construction works that were done at Wakiso School for the Deaf. We came here and started the works in September of 2023. This project was to take us 6 months. So by